Testing, testing, testing. That's what every epidemiologist, every immunologist, every responsible business owner, and everyone who cares about safely opening up our economy says we must do to successfully maintain a high standard of protection as we move into phase 3 and phase 4 of the Restore Illinois plan. You've heard me focus on it and report on it almost every day. And because testing is so important, I want to bring everyone up to speed again on where we are and how we are using the tests that we have. First, the White House just a few days ago called for all states to grow their testing to 2% of their populations in May. Illinois has far surpassed that level and has now tested more than double that amount. Using a 7-day average, Illinois is testing 4.7% of our population per month. And we won't stop growing our testing until this pandemic is over. As a result of our testing levels, we've been able to expand testing eligibility for the following groups of people: all frontline workers and essential workers, including workers in grocery stores and pharmacies, restaurants and gas stations, public utilities, factories, childcare, elder care, and sanitation. All healthcare workers, including those who provide home health services, nursing home residents and staff, all first responders such as paramedics, emergency medical technicians, law enforcement officers, or firefighters, all those who work in correctional facilities such as jails or prisons, all people with a compromised immune system or chronic condition, anyone with COVID-like symptoms, anyone who has had contact with a confirmed COVID-19 case, whether or not they have symptoms. We now have 251 public testing sites across the state that offer free testing. You can find a testing location near you under the headline Testing Sites under the Resources tab at coronavirus.illinois.gov. Again, coronavirus.illinois.gov. These testing sites also include our 7 state-run drive-through free testing sites at Markham, Bloomington, Harwood Heights, Rockford, Aurora, Waukegan, and East St. Louis. As I mentioned earlier this week, our Bloomington site will be operating in its current form through next Friday, and we're continuing to work with community leaders to further expand testing in that area. In addition, there are 6 new testing sites in the city of Chicago in Little Village, Pullman, Hanson Park, Englewood, Gage Park, and Bridgeport. We'll be launching 4 additional drive-through sites that are going live in the coming days. Starting tomorrow, our new site on the south side of Chicago in the Chatham neighborhood will begin testing, and sites in Champaign, in Peoria, and in Rolling Meadows will be opening all throughout next week. I also want to address our positivity rate. That is, the portion of our daily COVID-19 tests that are coming back positive. Overall, the positivity rate can be an indication of how widespread COVID-19 infections are among our population. We all want the positivity rate to come down, which would indicate a declining number of people getting sick from the virus. The great news is that the positivity rate in Illinois is coming down. Positivity rate is one of the metrics that we're using to determine whether regions are eligible to move into phase 3 of the Restore Illinois plan in the weeks ahead. Right now, on a rolling 14-day basis, every region is meeting our positivity rate standard to move to phase 3. If you're interested, regional specific data can be found at dph.illinois.gov/restore. I'm going to repeat that, dph.illinois.gov/restore. At a statewide level, our positivity rate over the last 24 hours for today's 26,565 tests is 9.2%. Our current 7-day average is 12%, and the cumulative statewide positivity rate since way back in February is 16.8%. Looking back, remember that our peak positivity rate was on April 4th, when 23.6% of tests came back positive on a rolling average. But I would urge caution in reading too far into this decline, as there is a strong inverse correlation between the number of tests taken per day and the associated positive rate, meaning that part of the reason for the lower positivity rate can be attributed to our increased testing. Remember, we surpassed 10,000 tests per day for the first time on April 24th, and we've stayed above 11,000 every day since then. Over the last 7 days, we've nearly doubled that with an average of 20,000 tests per day. The good news is that our current statewide positivity rate is under 14% on average for the last 14 days. And that's likely becoming a better indicator of the true infection rate among the general public than it was when testing was far more limited. Expanding testing, of course, is enormously beneficial to Illinoisans on an individual level. Having the ability to know whether or not you currently have the virus provides a small comfort in a world with so many unknowns. More tests also means more surveillance so we can respond to where outbreaks are taking place. But just as importantly, testing is fundamental to our ability to reopen the economy while controlling the spread of the virus. That's what it takes to keep the public safe while getting people back to work and back into the world. Over the past 2 months, we've made major progress in shaping a statewide testing program with strong building blocks, including the following. More tests. Well, we're the second among the top 10 most populous states for testing. Faster turnaround time for test results. More free testing sites. A focus on vulnerable populations like communities of color and seniors. Delivering tens of thousands of swabs for testing at nursing homes. And testing every resident and staff member at our state-run veterans homes. Reaching 20,000 tests per day is a great milestone, and we should celebrate it. It put us in position to keep more people safe from the virus and get people back to work faster, yet there is more to come and much more for us to do.